Welcome to An Awful World, but not awful like you think.
This is the show where we discuss whether we would have discovered important advances in a world exclusively full of Haylies and Libbys. I'm Haylie.
And I'm Libby.
And today
We're talking about medicine. Medicine, which, as you know, or you maybe don't know, we're both attorneys, which is why we had to bring in a very special guest to talk about medicine.
That's right. This is our friend Molly, who is a nurse.
Hi, Molly.
Hi, guys. Happy to be here.
Happy to have you and your
Yes.
perspective on medicine, because we are not STEM girlies.
Not even a little bit.
I'm here to be a STEM girly.
Excellent.
Love
Because
it.
we so clearly need it. Desperately. So
100%. So do you want to go ahead and get started?
sure, I can. I just want to start off by saying this is such a fascinating topic, especially because obviously medicine is a very, very broad topic. But just like reading about how it started out, oh my God.
Yeah.
A little spooky.
Literally, you could be haunted by ghosts.
Yes.
And that's why you're sick.
Yes, exactly. Yeah. So like folk medicine, like very, very early times, like it was a lot of trial and error, apparently, just like plants and like, well, this one, you know, made your burn go away, but this one killed you. So
This one killed
we won't
you.
use that
Noted.
again.
Moving on.
Anyway. But apparently, like in very early history of man, we did not think of death and disease as like natural phenomena. Like it was just like, if you died, it was like,
Happened again.
yes, like there's a demon that clearly possessed you and killed you. Or like, so it was all tied to like supernatural things. So like you are, you know, possessed by a demon, you did something bad, someone put a spell on you, whatever it is.
Witchcraft.
Yes.
Mhm.
So the treatment was just like spells and incantations and potions in response to like whatever you did, you're responsible for.
Spin around 3 times.
Yes.
Or
Like that's how it started out. And I think that is insane. Absolutely insane.
it took us a while to get away from that.
Yes.
To actually get closer to like evidence-based science as
Yes.
opposed to the spookies.
Yes.
I mean, my thinking though with that is like, if you explain something that way and then it happens multiple times, you're like, hard to argue with my logic, you know? So I get why it takes so long to get away from that.
Yeah.
But I'm also kind of just like, I don't know how you do get away from that.
Yeah.
Once you start going down that path, how do you just like break away?
We're going to talk about it.
The Greeks and Romans helped us out there.
Honestly.
And they started off with like battle wounds. So I think a lot of like, as war does, brings about a lot of
Advance.
advancement.
Yes.
Yeah. So the Romans were like, that wound looks icky. We should clean it maybe. So they started like dressing field wounds with like linens, and they would use salt water, olive oil, herbs, testing things out, wine even.
Wow.
Yeah. They would
Which
soak
honestly,
their dressings in wine. Alcohol.
It's
Yeah,
going to
alcohol.
kill
It's gonna
some
kill
germs.
bacteria.
Right. So again, trial and error. They're like, salt kind of helps with bacteria, but they didn't know what bacteria was just yet. And then even the Romans had like hospitals and makeshift ambulances. So like their little horse and carriage picking up folks who are dying on the field. So they did have ambulance, and they did like organized things
Yeah.
to help treat these soldiers and people who were injured.
Yeah.
Yeah.
Even if their understanding was super limited.
Yeah.
So one like early thing I saw that I was like, that's insane. But also I feel like it goes on for so long, just like by different names, is there was this thing called, and this is like still like folk medicine. It was called trepanning, which is when they would literally cut a hole in your skull to just like let the disease out,
Yeah.
like bloodletting.
Just vent it.
Yeah, just let it out and it'll be fine. But apparently, like, I mean, like we have evidence of like people surviving that and like recovering. So for a long time, they were like, this is working. And the people are like,
I actually have a hole in my head.
yeah, so
I don't feel so good about that.
Super great, but I am still alive. So at least there's that.
I have another thing to focus on. Like the skylight in my head.
Yes.
Not my broken arm. Thanks.
So like kind of like you were saying, like, yeah, once you start going down that road, it is like hard to argue with the logic. And then like, hence like witch doctors and sorcerers were like a legit thing because they were like the people who healed people.
Yeah.
Even if it was just like,
Take some mercury. Try some lead.
Yeah. Try this and see what happens. Oop, too much. You went crazy. My bad.
Ooh.
Maybe some cocaine will make it better.
Nuts. But then we had like recorded history. Yay for calendars and record keeping, because then we can keep track of so many things. So I thought this was so interesting. I can't remember where this was, but like for early doctors in the 18th century BCE, they like, it was a very like, I don't want to say quid pro quo, but it was like, if you were like draining an abscess on a patient's hand and they died, we chop off your hand. Like, it's only fair.
Oh.
It is only fair.
Type of thing.
Wow.
How do you feel about that as a nurse, Molly?
Not great. I would have nothing left.
Like, that's super encouraging for these people who are trying to like advance this field. I just thought that was nuts.
And I feel like during that time, the cure to a lot of things was let's poke a hole in you and leak things out.
Yes.
So like, I was reading about the humors. So there's like the 4 humors that are related to like elemental qualities of hot, cold, wet, and dry.
Yeah.
So you would fix things by like hot water, dry blanket, like things like that. And I saw something that was kind of funny. So you could sort people based on their appearance into how much, like which humor they have too much of. So people who have red blood are friendly. They joke and laugh about their bodies, and they are rose tinted, slightly red, and have pretty skin. Okay.
All right.
And people who have yellow bile are bitter, short-tempered, and daring. They appear greenish and have yellow skin.
It's because they're alcoholics.
Yeah. That in fact was jaundice.
Yeah. Your liver's actually failing. That's why you're so cranky.
Yes. And you know what? I think that's fair. I would be cranky too. People who are composed of black bile are lazy, fearful, and sickly. They have black hair and black eyes. So they're very specific. I'm like, what if I don't fall into any of these categories?
Right.
And those who have phlegm are low-spirited, forgetful, and have white hair.
That's old. Me.
I was like, I think I relate to the phlegm girlies the most.
Oh my gosh.
So, yeah, that's how we fixed you. It was like, oh, if you have too much phlegm, you have white hair. So we got to do something about that.
We have to fix that.
Yeah.
Yeah. Apparently there was like much more focus on like addressing the body as a whole instead of just like, your arm is broken, so we need to put it in a cast. It was like, no. Like, we've got to like rearrange your whole life. Like,
yes.
You need to start drinking tea, okay? And you need to like, it just very like overall, instead of just like, no, there's just this one thing wrong with me, actually has nothing to do with like my diet. My arm's broken.
Yeah,
because I fell
off
on
my
it.
horse.
Right, yes.
It was in fact gravity that did that to me. not anything that I could fix.
Well, I mean, it's actually still kind of like that today, though, when you go to the doctor as a woman and they're
as
like,
a woman, yes.
You should take a walk about it.
Yeah.
Maybe drink some water.
You're like, whoa. You're being hysterical.
Yeah.
You're just a woman. You're fine. And you're like,
Well,
okay, I don't feel any better, but here's $100 now.
Yeah.
Thank you.
You're
And now I'm just
overweight.
sad about
Okay,
it.
but my eye's bulging out of my
Yeah.
head.
They're like, well, maybe if you lost some weight, they go back in.
If you're listening and you're a man, that is literally what it's like
Yes.
to go to the doctor as a woman.
Yes.
You will be gaslit frequently, and then they'll take your money. It's something.
And then you'll have to follow up in 4 months.
Yes.
Yes.
And nothing will have changed.
No.
And by the way, you weigh the same, so you didn't take my advice.
And normally people telling you they're overweight are also like not the picture of health themselves.
Thank
I'm
you.
like, I
Yes.
get like we all want to like be healthy and stuff, but take your own advice before you tell me.
Yeah, don't
Yes.
be wagging your finger at me, you hypocrite.
Mm-hmm.
Speaking of hypocrites, no, I'm kidding. I was like, Hippocrates? No. But, Hippocratic. We'll
Yes.
get there. We'll get there.
So this whole humor business stayed along till like the mid 1800s. So it
What?
took a while.
Wow.
Mm-hmm. Mm-hmm.
What the fuck?
Yeah, and we even knew what bacteria was in the 1600s.
Yes.
So like we knew it existed to our bro Antony van Leeuwenhoek. That's when he discovered animalcules.
Which are?
Oh.
Because
That's
I
like
totally
what we know
know.
bacteria to be
Oh.
animalcules. So he looked at pond water and his own dental plaque. So could you imagine like looking at what's in your mouth under a microscope, seeing all these creepy crawlies, and
No.
then living with yourself?
No.
Yeah,
For the
no,
rest of
I'd be
your
like,
life.
all right, well, then
No.
I've been possessed by demons
Yes.
and I'm going to
Like,
kill
yeah,
myself.
Do you
Thank
know
you.
the amount of shit that lives in your eyelashes?
Oh,
no,
yeah, I don't want to
Yeah.
know about it.
No,
no,
It's like that episode of Brooklyn Nine-Nine where Terry like shaves, he like bleaches his eyebrows and his eyelashes and his mustache and then he just like shaves them all
Yeah.
off. And I'm like, yeah, if I don't want to know what's in there because I I don't think I could live with myself.
Yeah.
Honestly.
But it's just like stuff living on you and in you every day.
Yeah.
Which is kind of interesting because the early, like we were just saying, like the early people, like it was a little like crazy and witchy. So can you imagine the idea of being like, there are these particles that you can't see, these little living things you can't see, and they get in your body and they cause you to like have disease.
That's why it took so long.
It
People
would
are
sound
like,
crazy.
Okay, very funny.
Yeah, all right.
Okay,
I'll be
crazy.
over here mixing my potions.
That was just the ghost, actually.
Oh, that's so crazy to me though. Until the mid 1800s.
Yeah.
That's nuts.
Yeah.
Oh, and when do you guys think like washing hands was taken seriously?
Oh, not
it
until.
That was not long ago either because I wrote something about that down.
You
I
think-
didn't put the year,
You
though.
would think that England would learn after they lost a third of their population,
A little cholera,
or just like,
dysentery.
Europe in general.
It was like the 1980s. Like I was telling
Yeah,
a
for the
coworker about
CDC.
this. Yes, she would go to the dentist as a child, and the dentist like wouldn't wear gloves.
What?
Can you imagine?
No.
Just like
You know what? This makes sense though, because you think about every like old restaurant you go into in the bathroom, it's like employees must wash their hands before returning to
I'm
work.
like, why do we
Like,
need the reminder?
Yeah, do we have to be
Yes.
told to wash our hands? That's gross.
Yes.
But it's everywhere.
It's like when COVID first started, and I remember my mom and my grandma kept calling me and being like, make sure you're washing your hands. And I was like,
I already
are
do
you
that.
not?
Right.
What?
Why do we
I
need these
always
reminders?
wash my hands. Who are you
No,
telling this
we're past
to?
that. I'm washing my hands. Now I'm washing my mail. Okay, like
Oh,
that
right.
was
What a
like
time.
peak COVID, where I
Yes.
would take like a alcohol,
wipe?
yes, and just be like, oh, God only knows what the mailman had, and like, yeah. So, but apparently the Greeks are really the ones that are like sharp when it comes to medicine. So we have to give them their due. They were like, they thought the Babylonians were like total amateurs, which I think is funny.
As
They were
it
like, Babylonians, they don't know medicine. We know medicine. So apparently the Babylonians would like, this is my favorite fact. No, I have a lot of favorite facts for this episode, but this is a good one. The Babylonians would lay dying people in the street so that passersby could stop and offer their advice. It's like,
A little crowdsourcing.
yes, exactly. Just early crowdsourcing, just like, I don't know. You're looking a little, think you're hungry? No.
Maybe a haircut.
Yeah, maybe something like that. And they also just like, but the Greeks, kind of funny because they didn't understand that like fevers are like a symptom of something and not just their disease
The
in
disease
itself.
itself, yeah.
So they would like starve you if you had a fever.
Rude.
So that's where we think the phrase like starve a fever,
Oh, feed a
feed a
cold.
cold
Yeah.
came
Yeah.
from, is because that would be their method of like trying to help people get over a fever. Not nuts.
That's
Nothing
wild.
makes you feel better than starving yourself.
Yes.
I love
Ugh.
that.
Ugh.
I never do that.
I mean, I was always told that in the 2000s. So
That's true. That's a
you
whole
know.
other problem, though. Whew.
Yes. But the Egyptians,
Mhm.
oh, our friends, the Egyptians, they really helped us, not intentionally, because they, long before the idea of embalming people came along, they mummified people, obviously.
Mhm.
We know I'm obsessed with mummies. This is just a fact of life about me. But they actually preserved the diseases that they had.
Oh,
wow.
fascinating.
Yes, so we have been able to observe in mummies arthritis, gout, tooth decay, gallstones, a bunch of stuff. We did not find, however, any STDs. So good for them.
Wow, good for them.
Practicing safe
Yeah.
sex.
Yeah.
Yes.
Love
we
it.
love that for the Egyptians. But fascinating that like we have taken mummies and been like, oh my God, like they had all the same
They were
problems
so
that we
smart.
did.
It's like,
Yeah.
we know we can't figure this out now, but somebody will.
Yes.
Yes.
And they'll follow our breadcrumbs.
Yeah, it'll be fine. We'll leave the pyramids and they'll understand.
Yes.
And we're like,
Yeah.
aliens helped you build that.
And they're like, what?
Next.
No, we did all this hard work.
Next. But yeah, so like not until like 460 BCE, which is when Hippocrates was born, do we really start recognizing like diseases as something that is like natural for the human body. Death is natural. And that like really changes. So Hippocrates is considered like the father of medicine. Love him. And then obviously, well, it's obvious to me. I don't know why, but like there's the Hippocratic Oath.
Mhm.
Yes.
Which is really more just like, if you're listening and you're like, what the heck is that? It's more just like an ethical code for people who practice medicine.
no harm.
Do no harm. Exactly. So apparently Hippocrates was like very concerned more with like prognosis and not like exactly why the disease was happening to you. It's like,
That kind of makes sense.
right. Like, and it's a little bit of like what we have today, right? Like you have a fever. We're not ultra concerned at this moment with like why you have a fever so much as we need to get this under control.
Right. Yeah, put fires out.
Exactly. And then figure out why it is you have a fever. So that kind of like changed the face of medicine, because we're not, being like super suspicious and witchy about it anymore. And we're actually like, okay, this is like a normal thing that like happens to be like everybody dies. Have you thought about that? Like that had to occur to somebody at some point, like, oh, this is normal. Okay.
Yeah. Like not like, we all just like hit a point where we're just done.
Like we're meant to die.
It's almost reassuring sometimes.
Yeah.
Yeah.
But none of this matters. No, I'm kidding. Thoughts for your thoughts. Dark thoughts for your thoughts. Keep it to yourself. So there was like a super famous med school in Alexandria in Greece. And so the Greeks are really like, they really helped us out. Hippocrates really helped us out. And then I have just like a big jump in time where like until 161 CE, we did not accept that there's like blood in your veins until then. They thought it was air.
Oh.
I don't know what's coming out of you when you get cut open. For me, it's cheese. But for most people, it's blood. So, but they still didn't like understand circulation like well until like the 1600s, I think.
See, and I had like in 500 BCE, they were distinguishing the difference between veins and arteries by like cutting people open and things like that.
Yeah, we were real morbid.
Yes.
That's how a lot of discovery came across.
I'm just constantly thinking, how many really bad people made these discoveries? Because this is to me all serial killer behavior.
Yeah. Rene Descartes. Like, so do you know Rene Descartes?
I don't.
You don't? Okay. I don't know where I learned about him. Possibly in some class in college. But he is mostly known as being a famous philosopher. He's I think therefore I am, right?
Yeah.
Which yesterday my boyfriend was like, yeah, he's to be or not to be. And I was like, that was Shakespeare, you dumbass.
A little different.
It's a different sentiment. But anyway, Descartes was, because human dissection was illegal at the time. Not that it's legal now, but like we can cut people open when they're dead. Yes. Yes. But he would cut animals open while they were still alive to see how things worked.
Which is big time serial killer behavior.
It is. And I'm like, it's so hard because I recognize like the best way to understand like how something works is to like
take it
apart.
Yeah, like take it apart and look at it. But like, they're still alive.
Yeah.
Yeah, no.
Ooh, big ick.
Yeah.
I'm not going to be doing that in an awful world. And I don't think any Libbies are going to be cutting open any living thing.
This is why I think that medicine is going to stall out real quick. We're going to use some like Eastern medicine techniques of like herbs and, things like that the best we can. But like, I won't be cutting into you.
No, not even like if you're passed out, I don't think.
No, I would be like, oh my God, come to. Like, don't let me slice you open.
You're born with it. You're going to keep it.
Yeah.
Tonsils, they're yours forever.
Yes.
100%.
No, we're not. I don't think either of us can like stomach that.
No.
I can watch it. That's what's interesting. I can watch like surgeries and not be bothered, but I could not do it.
I think in the moment though.
Like if your adrenaline
push
is
came to shove, yeah,
maybe
like the critical thinking, like it's an overdrive, and you're like, I'm gonna figure this out.
Yeah, it's possible. I don't know. And surgery,
I hope you're never in that position.
Me too. Me too.
I will say, blood makes me pass out. So
maybe not so much.
I don't see it happening for the Haylies. We would do very little for medicine.
The Libbies only get squeamish about blood when it's, or not even about blood, but just like about an injury if it's like on me. I can watch, I could help other people, I think, but when it's like happening to me, I'm like, ooh, I can't look at that. I don't want to look at that.
Yeah.
And see if that's bad or not.
Yeah.
And it's too real. It can still be a little make-believe when it's somebody else.
Yeah. And you're just like, this is fine. Everything's fine.
Yeah.
This is all fine.
I like to like pick. I could do dermatology type things. I could do that kind of stuff.
Like wound cure, you like debride your wounds.
Yes, pick and like peel and that kind of stuff. Once there's like blades involved, I'm kind of out. I am kind of out, I will say.
Ooh.
So
I don't know. I really like to like lance things.
It's
really satisfying.
Yeah.
Yes.
I can do small things, but mainly like on my own face. That's about it.
Yeah.
But I
It'd
just
be
don't
weird if you're going up to other people's faces.
see, but
And
like
lancing them.
someone would have to.
That's true.
That is true. Actually, let them come to you and say, "Can you help me with this?"
Yeah. I'd be like,
Don't
ooh.
approach someone with a knife.
Yeah.
That's usually
That's
not
serial
good.
killer business.
Yeah, it is. It's a fine line. Let me tell you, it is such a fine line. Hey, listener, if you're in the Indianapolis area looking for warm photos of you and your loved ones, you're going to want to check out Hey Blondie. Hey Blondie is committed to capturing people from all walks of life through all stages of life, from a new baby to graduation. Check out HeyBlondiePhoto.com for more information and give them a like on Facebook and Instagram at Hey Blondie Photo. Something that I thought was hysterical is that the Romans contributed very little to the advancement of medicine.
They were so busy doing
I
other
wrote down,
things.
ha! Because men are always with the Romans. They're like, they're Romans. And I'm like,
Aqueducts.
they were fighting people, and it's the Egyptians are where it's
Yes.
at.
Mhm.
But
They're our Roman Empire.
they were super into public health, which is kind of cool. And the
Yes.
reason for that is because their society was so developed
Mhm.
that they had the aqueducts, they had like public bathing houses, they had like a sewage disposal system. So they
good
were
for
more
them.
concerned
Yeah.
with the public in general being healthy, which is like kind of important, kind of super important.
Which definitely leads to everyone being healthier
It's
to
like
not
preventative.
having yes.
exactly.
Mhm.
Yeah.
Yes.
It's a good thing for sure.
100%.
And like obviously, like if England had been, I just shit talking England, I'm so sorry. But if you guys had just been like a little better with like not shitting in the street,
Or like leaving
then-
your corpses places.
right, then the plague wouldn't have happened.
Yeah.
But it did. So that's where we're at with that.
Fortunately.
Yeah.
Now, I know, Molly, you mentioned the hand washing thing
Mhm.
and that for the CDC, it's like the 1980s, which
Mhm.
is unsettling.
Right.
But even before that, did you read about the how midwives for the
Yes.
maternal?
Fascinating.
Yes, so the
We knew
maternal,
for so long that we should wash our hands.
Yes.
It took so long.
like the maternal mortality rate was so high,
Mhm.
and midwives were doing so well. It was like 38 deaths out of 1,000.
And they were like, hello.
And doctors were like 90.
almost 100.
Yes, it's like
90
90
per
to 8
No
per
way.
1,000
Yes.
deaths because, oh my
They
God,
wouldn't wash their hands and then they'd be sticking their hands up inside
Oh, you
people
just-
they were doing autopsies
before.
and then going and delivering babies and
Mhm.
not washing their hands. They are rummaging around in
a
dead people
dead body.
and then not washing their hands and putting their hands in a woman
Isn't
to
it-
help give birth.
Isn't it just instinctual to you that when you touch something icky,
Yes.
you want to wash your hands?
Absolutely.
100%.
That just blows my mind.
Uh-huh.
But
So-
of course, men.
100%.
And like it took them a while to get to the point where they're like, oh, maybe we should wash our hands.
Is it us? Are we the drama?
right?
I don't think we're the
But
drama.
then didn't somebody say like, hey, we should start washing our hands? And then wasn't he
Yes.
kind of like shunned?
Yeah, so it's Dr. Semmelweis. He obviously worked on the doctor's side of this hospital ward. So it was split. Midwives, doctors. And this doctor was like, all our patients are dying. We should probably figure out why. So the first theory was the priests.
Of course.
We thought it was the
Obviously.
priests. So
Can't ever get away from it.
So these women would be like in the throes of labor. They would come around and do the last sacrament, thinking that they were going to die.
Oh my God.
So they would ring a bell for the last sacrament. And they thought that even though the women might not be dying, the bells would be scaring them to death.
The bells.
Yes.
Like clocks
so
a
even
bit
if
around.
you're not actually dying, you hear the bells, you're like, shit. And then you die. So that was the first hypothesis. So they removed the priests from the ward.
Okay, great.
And it made no improvement. I
Killer
know you're
priests.
shocked.
No.
Shocked.
You're telling me that the bells weren't scaring these women to death?
No,
Oh my God.
the bells
What
were
was
not.
happening? I have
No. Yeah, so that made no difference. And then, so Dr. Semmelweis was like, well, I'm going to go on vacation and I'm going to think about it for a little bit. And when he came back, one of his doctor friends had died because he was doing an autopsy and cut his finger. That finger became infected and died of infection. So Dr. Semmelweis was like, the cadaveric material.
cadaveric.
Yes, those particles are infected.
Ugh.
And then
Yeah.
you're touching these women. And then that's how you're killing these women with childbed fever is coming from the cadavers.
Yes.
So yes and no. Like, it's not the cadaver material. It's not like anytime you touch a dead body, you're going to touch someone and they're going to get sick automatically. Like, there's obviously just like germs going from one thing to another.
Right.
And that's why these women are dying. So he's like, we should wash our hands. We should wash our hands with lime chlorinated water. So, like, we know chlorine, bleach, like that's going to do really good at killing things. Doctors didn't like that because doctors didn't like being told it was their fault.
Checks out.
Typical.
Yes. Yeah. So while midwives weren't doing any sort of autopsies, they're just like going about their business, keeping their mothers and babies alive.
Yeah.
Yeah.
So they weren't affected. So the doctors kind of start washing their hands, and the maternal mortality rate improves. But that's what happened with Dr. Semmelweis, is he's like chastising his coworkers, like, you need to be washing your hands. And they're like, don't tell me what to do. So he's screaming into the void and ends up going crazy.
Yeah, that he's being gaslit by all of his colleagues.
Yes,
like, you're nuts. That has nothing to do with that. They're this is just what happens. Women have babies and then they die.
Right. So he's going around telling everyone wash their hands. They're not listening to him. He gets fired. Even though his idea was right, he gets fired.
Wouldn't you think, though, that they would be seeing that his numbers are better than everybody else's? And they would be like, maybe he's right.
I think the thing is, the doctors didn't want to look at the numbers because they didn't want to be like, this is clearly our fault. Maybe we need to change our practice. They're like,
so familiar.
No.
I know.
Right? Right? We're just going to keep doing what we're doing. Dr. Semmelweis is out on the streets. So he ends up getting admitted to an insane asylum.
Oh my
He goes truly
Wow.
crazy.
That poor guy.
He ends up dying of sepsis, which was what he was trying to prevent the whole time. Like,
that's so
poetic
sad.
injustice.
Yeah.
I'm also just like, I'm sorry. You're telling me that these men wouldn't wash their hands because they didn't believe it. But when Typhoid Mary doesn't wash her hands after she uses the bathroom and then starts cooking for these families, you're going to come after her? Hypocrites. Hippocrates.
Yeah.
That's fascinating.
Yeah, that's wild.
I feel very sad for him because you never get to see you have your moment where people are like, oh my
This is
God,
my
you're
legacy.
right. Yes, exactly.
Yeah.
It is now. He just had a very
But he didn't get to
unfortunate
enjoy it,
end. Not
you
at
know?
all. Not at all.
Of people being like, you're right. This is clearly like there's a correlation here.
Mhm.
Right. Well, and if he wanted that, he should have just been an artist. They never get to enjoy their legacy either.
That is very true. Artists, poets, that sort of thing.
Mhm.
Yeah.
So that was all happening in the 1800s. A lot of things were heading in the right direction in the 1800s. It's like Florence Nightingale is like heralded as like
the mother,
the mother of nursing,
Yes.
right?
Yeah.
So she was working during the Crimean War, and the hypothesis then was foul odor leads to infection.
Not totally incorrect.
Right.
We're on the right track.
Right.
Yeah.
So she was like, if we clean things from having odor, then we won't get sick.
Mhm.
So like she was like, wash your hands. It's
Right.
not that hard.
Right.
Wash your hands. Keep your space clean, and we're going to reduce infection.
Right.
Yes.
That seemed to click on a little better. But again, like, it was women
Yeah.
telling women. And we're like,
and they were like,
that seems like a good idea.
you know, and we like clean things anyway.
Right.
Yes.
And stinky stuff kind of
Right.
sucks.
Yes.
So,
Yeah. Interesting.
Yeah.
Hmm.
Well, jumping back from the 1800s a little,
Mhm.
I have that we didn't have a first practical manual of anatomy until 1316
Wow.
of actually, which in some cases seems really early to me.
Yeah.
And then
when was the printing press a thing?
the 1500s, so the
Okay.
16th century.
Okay.
Yeah. So kind of impressive
Yeah.
that it was that early.
Yeah.
Obviously that came from doing a lot of dissecting.
Yep.
But mostly after people had died to be like, okay, what is this? How does this work? How does this go together? It's just so interesting to me because that is something that we just know. Yeah.
Like
Yeah.
middle school.
Right.
Yeah.
You
Your
learn.
hip bone's connected to your
exactly.
leg bone.
Yes. Whatever. I mean, that's just totally you just learned that in health class. Whatever.
Yes.
Everybody knows this is what a skeleton looks like. Can you imagine not knowing what a put together skeleton looks like in your body?
And
Yeah,
what if you
no.
just drew what you thought it looked like? How many different variations
Right?
you would have?
Oh my God.
So many.
Which I kind of
Ooh.
think is what happened.
Mm.
Is that through time, people were oh, this is, but we didn't have a complete picture.
Mhm.
Maybe just had pieces of the puzzle and then some guesswork in between.
Mhm.
Yeah.
But yeah, 1316, which is just kind of impressive. Good for them. But The 18th century. Yeah. Germ theory. That's like
love germ theory.
Really when it came around.
Yeah.
Or the 19th century, actually, the 1800s.
Yeah. Right. So Robert Koch, Louis Pasteur, and Joseph Lister, bros, putting it together.
Yes.
Getting us some germ theory so that we know that, the animalcules that we actually knew about in the 1600s are now back on the forefront.
Yes.
And now we have a cause for disease.
And not only do we know that they exist now, we're going to use them to our benefit. Louis Pasteur.
Love.
What a guy.
Really.
What a guy.
And like, what a happy accident.
I know, right? Oops.
I didn't want to do dishes. Penicillin. Thank you.
Yes. Like, that's nuts. Like, just figuring out, from... I feel like so much stuff is like that, though. I'm not sure. Yes. I'll just go ahead and say it. I'm not sure that we would figure that out.
No, because he had like petri dishes and then had the
microscopes
mold in there and was like, the mold is preventing the bacteria from growing, which to me, if I see mold, I'm like, ew, trash. Ew, trash. I'm not going to be like,
good reaction.
Let me put it in a petri dish.
Right.
And be like, gross. Get out of my house. You're green and fuzzy. It's nasty. I'm not doing that.
Gross.
Not. And then, of course, you have to, from there, make vaccines and, do all those things. And they're like, you take the disease and then you take part of the disease out and then put it back in you.
We're just going to give you,
psycho.
We're just going to give you a touch of rubella.
Yeah.
Let your body get over it. And then you're good.
And then you're totally fine.
Yeah.
And
that would not be the, theory that I would come up with.
No. If someone was like, hey, let me inject you with the flu. And then we'll just see how it goes.
It's just like the LaCroix version of the flu.
Right.
Yeah,
but
just a whisper.
I would be like, absolutely not. You're not infecting me with a little bit of anything. That's horrible. I would just never think, let's just try it. Let's try it. Let me just try to give you the flu. Just a little.
Why don't I try to give you the flu? How about that?
Exactly.
I feel like a lot of early scientists, so they were doing all sorts of shit on themselves.
Yeah.
All sorts of things.
100%.
Like you have to. Like,
right?
What are you going to do?
I won't believe you unless you did it to yourself first.
Exactly. Like, who's going to just trust you to do these things? I mean, nowadays people do, but we have more science.
That's true. Now we do.
And they get paid for it. So they're like, all right, fine. But back then they're just like, probably do seem like a psychotic man who's just like, all right, let me just inject you with stuff.
My magic snake oil.
Yeah. And you're like, no, crazy. Absolutely not.
If anyone comes at me with those hands, no. Back away from me.
Exactly.
That's gross. Gross. Do we know when the first vaccines are? I know the first antibiotic is 1928.
Yeah, so that's when penicillin. That's
not
when
even
I saw
100 years ago,
right?
What?
Right, and it wasn't introduced to the population as a whole until 1945. So again, with war,
wow,
it was more of a World War II thing.
Yes, people are dying on the battlefield.
Yes.
We need something for these infections.
Yeah, they probably were like, just push it through, just give it to him, give it to him. We'll see.
Right. Yeah. So it started with World War II, and then it broads the first miracle drug, truly probably one of the best inventions that modern man has ever come up with.
Modern woman has ever come up with.
Thank you. Was antibiotics.
Yeah, that's nuts.
Right?
Yeah.
And then now we have the other side of the problem. We're antibiotic resistance. We're overusing it because it was this miracle drug.
Yes.
And we abused her.
Mm-hmm. Yes, we did abuse her. And some people are just I'll just take a few, and once I start feeling better, it's oh, no. You got to finish.
You got to finish it.
You got to finish her out.
Mm-hmm.
Yeah.
Mm-hmm.
And now it's just it's become so insane. So again, doing research with my boyfriend is difficult because he just likes to talk to me about things while I'm trying to research, and it's whatever. But he did bring up something good that I was like, oh my God, yes, fun little anecdote. So there is, he was a football player, and now he's an analyst or whatever for ESPN or somewhere else. I can't remember. His name's Boomer Esiason. All of this is to say that his son, we just watched a kind of one of those ESPN 30 for 30 things about his son who had CF, cystic fibrosis. And obviously have that disease since you're a child. It's a genetic mutation, whatever. There's really the medicine around CF has gotten a lot better over the last 30 years. They actually live, fairly normal lifespan now. It's not as much of a death sentence as it was before. But anyway, his son was involved in this trial for a CF drug, and literally just in the course of 3 days, coughed all of the phlegm out of his body, all of the mucus out of his lungs and is now completely fine
That's amazing.
Wow.
because of just this one like miracle drug.
That's fantastic.
And like, it blows my mind. Like, how do we even come up with this stuff where we're like, well, this one thing attacks, this part of, this enzyme or whatever.
It's fascinating how far we've come.
It's
from
nuts.
like the humors to
Right.
microscopic
think
things,
about-
gene editing. Oh.
That's only like
it's wild.
150 years ago
Mhm.
that we like get rid of this humors thing. And now we can like manipulate this stuff to do exactly what we need it to do. Nuts.
Yeah.
What's insane to me, though, is we've done all of these things, proven all of these things as a society, and now people are like, I'm not getting vaccines. I'm not doing that. I don't need those. That's been eradicated. Or it gives you autism.
It's
And I'm
been
like,
eradicated.
Polio will sneak up on you.
yeah.
Yeah. And then you'll be unable to walk.
Iron lung, baby.
We'll put you in the
Exactly.
iron lung. It's not going to be good
Mm-mm.
I'm just like,
for
what?
you or anyone else.
No.
I know. It's so funny when people are like, well, it's eradicated. Yeah, it's eradicated because of vaccines.
Yeah.
Right.
Yes.
So, we
So,
still all have to get them to
mean-
keep it
Yes.
at bay or it will come back.
If you really want the measles, we can give it to you. But like,
it's not
let's
going to be a
just
good time.
get it over with.
No.
And then we can just get people like you out of here.
Well, and it's like, even when we were kids, so I don't know if you guys got the chickenpox vaccine.
Yes.
Yes.
I got the chickenpox. I was only one.
Oh.
So my mom had a rough time with that. But, she was like, well, back then it was like, well, one kid got the chickenpox and then you had a chickenpox party. So all your kids could get the
Oh,
chickenpox
no.
so that you got rid of it.
Okay,
Just
I
get it
get
over
that.
Get it over with kind of a thing. Because once you have them, you don't get them again.
Yeah.
Except for some people
You get
who
shingles.
Yeah.
get the shingles, which is
Awful.
my mom. So she
Aw.
can't ever be around people like that.
Mhm.
Shingles
But
are terrible.
it was kind of like when we were young, it was the time right in between there of do you get the vaccine or do you just let them get the chickenpox? And I think I just accidentally got the chickenpox.
Yeah.
I don't think my mom took me to a party because I was like one. And I don't think she was going to be like, yeah, this is the
This
time.
sounds like a fun weekend idea.
Right.
Let's test it out. See how strong she is.
But it was kind of one of those things where people were like, well, why do that when she could just get it? And I'm like, but why would you want your kid to get it
Yeah,
and
it's
be
not
miserable
fun.
for a
Yeah.
week?
To have.
Wouldn't you rather just give them a shot that lasts 2 seconds
Right.
Mhm.
and then they never, ever have to deal with it forever?
Yeah.
And it's like,
it's a moment of discomfort for a lifetime of not having to deal with those sorts of things.
right.
I would take those odds.
Yeah.
I mean,
100%.
Yeah, my choice every time.
Because
Yeah.
I don't know if you okay, so when I was in college, there was a mumps outbreak.
Oh, I do remember this.
Mhm.
Yeah, I remember that.
And so obviously, I had the MMR vaccine as a kid,
Mm-hmm.
but everybody had to get revaccinated at school.
Oh.
It was like a New World Order type of thing. You had to have this card
Oh, wow.
that you had been revaccinated. I don't know, Haylie, I'm sure Molly has because this is, Molly's livelihood. I don't know if you've ever seen someone that has mumps.
No, I have not.
It's bad. Like there was a hockey player, I don't know, maybe 10 years ago that had it, and his face was huge
Mm.
from it.
I have seen that Brooklyn Nine-Nine episode where they
Yes.
get it and they have the goiters.
Yes.
But
What a
that's all
cute
I've seen.
word.
Mm-mm.
It's like what the sound of it looks
Yeah.
like. I don't know. Ugh.
It's
Yeah.
the same thing with the plague where it's it's the bubonic plague because of the
Buboes.
buboes full of pus and
Black pus.
barf.
Mm-hmm.
But anyway, just why this is so easily avoided.
Right.
This is not I would say that's probably more uncomfortable than the chicken pox for these people.
Yeah, I would
Mhm.
assume.
Especially when you're an adult. It's like when you get your tonsils out as an adult and it's 10 times worse than if you had just done it when you were a kid.
Yeah.
Right.
Yeah. Why? We have this thing. I don't know. I don't need to preach to the
yeah,
anti-vaxxers
I know.
on here.
Yeah.
Yeah.
But-
I feel like people who've made their mind already,
Yeah.
it doesn't matter what you're going to say. They're
I
still
know.
going to stick with it.
But just
okay, that's your life choice.
That is
Whatever.
the
Right.
impact of it, though.
Yeah,
My
'cause
fairly, not. It's a small university, but enough people that we have to all go to the gym and get our MMR follow up, even though we've all already had it.
Yeah.
That's nuts. Come
Yeah,
on.
It's insane.
Yeah.
So, well, with that, how far do you think with medical advances could we get in an awful world? Do you think we'd ever get far enough along that we would regress like we have currently?
No.
Or is the regression you're talking about with vaccines?
Yes. how people are just not doing it. We're just all blatantly, I mean, we are not, but like people out there are just blatantly ignoring it at this point.
I think it's just human nature to like not want to do what you're told to do sometimes.
That's true. I am one of those people.
I feel like so when you have facts to back up the decision, you're like, okay, this is based in science. I understand the evidence here. I'm making a decision to go with what's like prescribed to society.
Right.
Yeah. I mean, since we're not such STEM people, I think that we're unfortunately going to stay in that, like, I must have done something to like deserve this, like,
I do too,
this mentality for probably too long. But I think that you're right that we stay with Eastern medicine pretty, I don't know.
Yeah. Like exclusively.
Yeah.
Yeah.
I mean, I just don't know if we ever get to the point of like Western medicine like it is today, because it
I don't
was
think so.
so much cutting people open, figuring out how things work, trial and error with like a lot of crazy shit. You know what I mean?
Yeah.
Like, have you ever thought about just like your liver, like to find out that
all the time
half of it grows back if we cut it off? Well, we had to cut half of someone's liver to figure that out.
Yeah.
And like,
and then just like
regenerate.
watch it. Like,
oh
like,
my
I'm
God.
going to take this out of one person and plug it into another.
Right.
Yeah.
Fingers crossed. Or like we've taken like pig hearts and put it into humans too.
Yeah.
Is
Which
wild.
is
All kinds of stuff.
Yeah.
Or like skin grafts, the way, they have.
Do like fish scales.
Yeah. It's amazing. I absolutely recognize that medicine is amazing.
100%.
And there are some necessary, albeit a little bit sketchy, advances along the way or choices that led to it being so amazing.
Yeah, we tiptoe around ethics a lot.
Yes. Although I think that has gotten significantly better in the last 100 years, probably.
Yes.
That we're much more like,
There's like
it is.
institutions in place specifically to make sure research is ethical.
Yes.
Yeah.
Yes, absolutely. So, no, I don't think we ever get to the point of it being so like, I don't know that we ever figure out germs. I think that we are both just like clean people.
Yeah. I think we would learn the hand washing thing way earlier. I don't think it would be the 1980s.
No.
Before we're like, you know what, we should implement this.
But that's not coming out, at least for the Libbies. That is not coming out of like, when I touched this person after I was rummaging around in this dead body, they got sick with an infection and then died. It's just like, ugh, like when I'm cooking dinner and I like touch something and I'm like, ugh, and then I have to rinse my hands off and then go to the next thing and I'm like, ugh.
It's like every time I crack an egg, I'm like, oh, hands.
Yes.
Oh, hands.
Ooh,
like anything gooey, anything raw.
Yes, exactly.
I won't even touch the raw meat. I have to I cut around and then I like use the tongs, and that's like two times a year.
Yeah, you are, honestly.
More times than not, I'm like, I just won't cook it.
Next thing you know,
not me.
She's going to be operating one of those like robots that does the laparoscopic surgery.
The Da Vinci machine.
That's how I cook my dinner.
This is $1 million dinner.
Every time. It's chicken nuggets. Yay.
Yay. But they're hand breaded by a drone.
That's right. Well, do you have anything else on medicine, Molly?
I think we could probably talk for hours.
I know, we really
about
could.
medicine and just how cool it is.
Yeah.
What's your like favorite like medical advance fact, something that you're just like, this blows my mind. Like, I cannot believe XYZ or whatever.
Other than what we've talked about as far as like antibiotics and like basic hygiene, because that got us pretty far. I think it's amazing the things that we can do, like low intervention kind of stuff. So like previously, like if you needed something with your heart, it's like open heart surgery. We're cracking your chest. We're in there, like someone is elbows deep in your chest. But now we can do so much just with like a tiny little pinprick, like through an artery to get to your heart. And we can work on the inside from the outside.
Yeah.
So I think it's super cool that we can do this huge, really serious procedures, but like with minimal invasiveness.
Yeah.
Yeah. These are things that like, even in my wildest dreams, I don't think I could have thought up, like before they were invented. I couldn't have been like, what we could do is have a robot that we like go in and do these little minimal. Yeah. And I'm like, no part of me would have been like, this would be so cool if we could do this. I just don't think I could even think that far. Cause I'm like, oh, you can't do that. That's insane.
Cause even like, if I didn't know because of health class that we like have veins and arteries, I probably just think it's just my whole like inside is just blood. Like, you know what I mean?
I thought that when I was little too.
Yeah. It's just like, well, that's just what, I'm just full of it.
Yep. Yeah. You're
that's
like, everything's just sloshing around in the blood.
Know that I have, like, because you're just, I don't know what it's called. I know there's a name for it about the fact that you just like, you can't like feel your own organs. like, you know what I mean? Mm-hmm. Like you're not just like, oh, my liver hurts. Like they don't have like pain receptors. You really don't. You can pretty much ignore your heart beating all the time.
You can feel the sensation to like go to the bathroom.
Exactly. Mm-hmm. Yes. Mm-hmm. Yeah. So I don't know that I would ever be like, yeah, there's totally something like
I have
bigger.
A kidney stone.
Yeah. Like, there's something bigger going on here.
Yeah.
I don't know that I would think that way.
No.
Other than like looking at your like, if you look at me, especially because I'm real pale.
Same.
I can
like
see
the
my
blue.
Yeah. I'd be like, well, that's weird. I'm just kind of like streaky.
But then you'd be like, well, what is that? Because then when you cut into yourself, that's all red. So you're like, then what are these blue things?
Yeah, definitely.
Like,
yeah, that's weird. I haven't thought about that in a minute. And it's just like blue until it's oxygenated.
Yeah.
That's wild. Alveoli. Something in your lungs. I don't know. Go on.
It is. Good
job. Well, I think we only have one question left for you.
Oh, yes.
It's a very important question.
Uh-huh.
In a world full of Haylies and Libbys, would you be a Haylie or would you be a Libby?
So, as a listener of the pod and just going off of how you got, I feel like I might be more of a Libby.
Okay.
Because, based off this conversation, I think I'd be curious after things have passed. I'd be like, what's inside? What's going on? I think I'd be a curious one to like kind of investigate further after they've left. I'm trying to like be delicate about it.
Yeah.
No, but I agree because I've said in previous episodes, like, where we talked about like tools and materials, like using animal bones. Like if something's dead, I'm probably going to be like, what's going on with that? Like I might touch it with a stick.
In the most respectful way.
Exactly.
Yes. Just
but I'm
kind
like,
of,
this is here for me to use, just kind of fell into my lap. What can I do with this? Or like, what can I learn from this?
Yeah.
About how to understand how something works or
Yeah.
I'm definitely more of I'm not afraid to approach like a dead animal.
Yeah.
And that sounds really spooky.
But in the context.
Yes. Yes. I'm not like.
This is for discovery.
I'm not like killing animals out here or setting fires or anything.
Not like a Jeffrey Dahmer thing. Like I'm not into like taxidermy or anything.
Right. Yes, exactly. That's a little strange. Yes. If that's what you're for, that's fine. Whatever. Mm-hmm. But like, I think I told Haylie like previously that on our back porch, we moved the grill one day and there was like a bunny that had just kind of died under there. And it was really sad, except it had like mostly decayed. So it was just its spine. And I was just like, that is so crazy. Right? Like, I just wanted to like look at it and and Brian kept being like, ew, don't go over there.
It's like, I'm not going to like touch it.
Right. I just want to look at it. I just want to look at it, see how it works.
Yeah.
Yeah. But not, I just to some extent.
Just like a healthy curiosity.
Exactly.
I think that's where I would be.
Yeah. But I did not like dissecting things in school.
We never had to dissect anything in school.
Really?
We did it as a video game.
Oh, okay.
That's cool.
So like we had to do a fish.
I remember doing worms first.
We did worms,
frogs,
and, like, sheep hearts, frogs.
Oh my God.
In college, I did all sorts of things.
Yeah. Did you ever
starfish?
Did you ever get to do like a real human body?
Yes.
Yeah. I figured that a lot of
that one is jarring. I was a little bit more taken aback than I anticipated.
Yeah. Wait, can I ask you one more question?
Yeah.
Have you ever been to the bodies exhibit?
No.
Oh my God.
And I would love to go.
Molly, it's so cool.
Yeah.
You would love it.
Yeah.
The bodies exhibit?
Oh, it is so like
it's so cool.
It's like taxidermy for people.
Yeah. So they just have bodies.
Where is this?
They have them all over, but
it's like a traveling thing.
I think there's one in Chicago right now.
Mm-hmm.
I could be wrong.
But yeah, they have like isolate different parts of the body, like doing a natural motion. So you can just kind of like see all the muscles, the tendons, ligaments. And they'll like, I think they have animals as well.
Yeah.
It is like you have to kind of go in knowing what you're going to see because it can be like,
it is jarring for sure.
Yeah. But I think it'd be so cool.
It is really cool. And I do remember that they had like fetuses at so many weeks.
Gestation.
Yeah. So you can see how gestation works, which is really neat.
They have some of that in Chicago at the Science and Industry Museum. Is that it? Yeah.
And they also do like, they've taken some bodies and done like different like cross sections of them.
Oh, yeah.
You know, so you can just like see this is what the human body looks like if you split it in half, you know, down. Like, this is what it looks like. This is what your insides, like, that's going on inside of you right now. It's really neat.
Yeah.
You would hate it.
Yeah. When we were in Chicago at the museum, they had a lot of those. A lot of it was just like the veins.
Oh,
and it was
so
just like splayed out.
And they have that where it's just the nerves of a person.
Unsettling. I was like, I don't really like being here.
It's
Fascinating.
bananas.
Yeah.
Like how much is going on inside of your body all the time.
It is.
And like, don't even get me started on the brain. Just like electrical signals, electricity. My
That
God,
blows my mind, too.
is going through your body all the
do you guys
time.
think like, I don't know if I'd put together like, let's just shock a heart.
Yes.
Let's just electrocute someone.
We'll just
and see what happens.
get it back into place.
Yeah.
Would not. I'm like, how did that come to be? Do you think it was like someone passed out and then they got struck by lightning or something? Like what?
I have no idea.
Some of it's just got to be happenstance. I swear.
And then they're
I
just like,
swear.
wow,
It's like,
that
well,
works.
we've exhausted all of their options.
Right.
Right. You know, like what?
The holy
guys?
water didn't work. Let's
Hear
just-
me out. I've got a car battery and I've got a couple of cables. Do
It's
you
like on
think?
1,000 ways to die.
Yes. Like
Yes.
It sounds like that. Like stupid though. You know what I
Yes.
mean? Where you're just like, what? What are you talking about? But to us, it's like so obvious because, you know.
That's what we do.
Yeah. And like we watch Grey's Anatomy and we're like, we joke about it all the time.
We don't get to use
Yeah.
the fancy paddles in real life. That's
They're
the
just
thing.
the sticky things,
Yeah.
right?
Yeah.
Yeah.
Way less fun.
Yeah.
I mean, it's still fun, but
It's
Yeah.
still fun.
Yeah, I bet it is. I bet it is.
Yeah. I bet it is.
Cool.
All right. Well, thank you so much for being on.
my pleasure.
Yeah, it was so fun.
Yes.
Medicine's such an insane topic.
Yes.
Hopefully we can have you on again in the future
I'd love to.
talk more like specifics about certain like medical things. And I think Molly's a wealth of knowledge when it comes to
Thank
those
you.
things. So
Definitely.
that is really neat to hear her perspective because I don't do medicine every day. I just read about it and pretend I know what's
It's
going
fun
on.
to read about.
It is very fun to read about. I had a lot of fun researching this topic. And there's so much more I could say. I wish I could remember, just as a one last aside, there was some guy, some physician, who he believed that there were like only two like states of being, like just like you're happy or sad, I think. And he was like, the solutions are uppers or suppressants. Like, so we can either use alcohol or cocaine. That's all I can
Yeah, rock
prescribe
and roll,
you.
baby.
Yeah.
Just like, wow, that's medicine.
Yeah.
Wow. That's certainly something. But yeah, just so much like interesting stuff. Thousands of years of history. And I think that's like where we like discredit ourselves a little bit. Is like,
Yeah.
we're thinking of our lives in a timeline of like 100 years max, you know?
Yeah.
But if we had thousands of years to figure something out,
You'd get there.
yeah,
I
Yeah.
have
Yeah.
no doubt you'd get there.
we'd get farther than I think
Yeah.
we give ourselves credit for. So.
Yeah. With medicine, though, I just have trouble because I'm like, ugh, I get the
I
ick
know.
so easily.
I know.
And I'm not
Yeah.
going to touch that. I'm not going to cut you open.
Who knows?
So,
Well, thanks for joining us in an awful world. Trying to make the world a little less awful day by day. But, you know, we'll see you next week. In the meantime, check us out on Apple Podcasts, Spotify, YouTube. Give us a like and a follow on Instagram, Facebook, wherever you do your socials. Just kidding. We don't have a TikTok, so don't look there. But yeah, we'll see you next time.
Yes.
Okay, bye.